Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And today we're going to, it's sort of a follow-up on something that we did about a year ago. We were speaking about memory disorder, and we were talking about memory services and things of that nature. So we've had such a response from you, the viewers, that I decided to bring it back. This is the time to bring it back. So let me introduce to you a returning person, Shelly Greenberg, who is a registered nurse, and she's the supervisor of the Memory Disorder Center, which is up at North Broward Hospital, which is part of the Broward Health System. She was very, very informative. So welcome back, Shelly.
Thank you.
Good to have you here.
Thank you.
And a long time, I mean, I won't tell you how long I know this gentleman, but this gentleman was an incredible participant in law enforcement and what I would call humanity in our community for many, many years. I don't want to call you just, I would love to give you your proper, I guess you could say, law enforcement title, but I'm going to leave that off, all right?
Yes, sir.
But this is Rick Braswell, and he's the chaplain now of the Plantation Police Department, but for many, many years worked with Broward Sheriff's Office.
Yes,
welcome,
sir.
Rick.
Thank you very much.
Welcome back.
It's good to be here.
Yes, sir. Let's talk about the Memory Disorder Center.
Okay.
Shelly, if you, just to remind the folks, what is the Memory Disorder Center?
We actually are one of 15 memory disorder centers in the state that are partially funded by the state of Florida. And we're required to provide an accurate diagnosis with the patients being evaluated. It's a multidisciplinary diagnosis. Patients are evaluated by a neurologist, neuropsychologist, geriatric psychiatrist, if appropriate. We're also required to provide training and education to the community, to healthcare professionals, and family caregivers. And also we do some research. Right now we actually have like 8 clinical drug trials that we're doing for Alzheimer's in the Memory Center. But one program that we offer, and we're the only facility in the state of Florida that offers this program, is called the Care Assistance Program. This program is open to the community. It's not just for our patients and caregivers. We offer the program 5 times a year during the day and 5 times a year at night. The day program is a 16-hour program, and the caregivers really need to commit to attend all 4 of those classes. It's 4 hours a day. And the night program is 2 nights a week for 2 consecutive weeks from 6 to 9 at night. The night program is mostly adult children and working caregivers, and the day program is mostly spouses. What we do is we basically give these caregivers the tools that they need to keep their loved one at home, prevent premature nursing home placement, prevent adult abuse. The speakers are volunteer speakers. We have attorneys that come in and speak. We talk about behavioral issues, medication management, who is eligible for veterans benefits, Medicare, Medicaid, appropriate time for placement, how to choose a home health agency, the different daycare centers that are available in the community. So basically, these are all the tools that the caregiver needs. And this program is actually funded through ADRC.
What's ADRC?
Aging and Disability Resource Center. And they're located in Sunrise. Through a grant for this program, we pay for a home health aide to go into the home and care for the person with Alzheimer's so that the caregiver can attend the program. We also pay for transportation to get the caregiver there. We have dinner ready at night for the adult children that come right from work that are juggling their families and trying to take care of a parent. So all anybody has to do is just call to register for this program. There's no charge for it, and it's open to the community. Any caregiver caring for somebody that has dementia.
Do you have a telephone number with a call?
It's 954-786-7392. We also offer about 8 support groups a month during the day and at night if anybody wants to attend any of our support groups.
Okay, we're going to get into this issue a little bit further, but I want to talk to Rick Braswell. Well, Rick, tell us about your work. I know that there's a lot that goes on with, we're going to talk about Silver Alert, I believe, and Lost on Foot program. So why don't we tell the people what your situation is, not just as a chaplain for Plantation Police, but your advocacy for these programs.
Well, this is kind of a real passionate thing for me since I retired from the sheriff's office and went to Plantation. We found out that many of our officers, when they were called out to specific scenes, they would meet someone who had Alzheimer's, someone who had dementia, someone who had Down, someone who had autism. And we found out in checking with our officers, they really were trained in other things, such as missing person, missing child, domestic violence. But some of the training that they needed in order to care for these people, they didn't have. They didn't know how to do that. So I got interested in that and started meeting with our officers. Then they started coming and saying, tell us how to do this. How do we handle people when they run into them so they can be kind and considerate and interested in their personal lives, and how to find their caregiver, how to find where they lived, how to find what kind of health and condition that they were in. So based upon Silver Alert and then now Lost on Foot, the program was developed where we now train our officers. It is in our training division. It's on our website in the police department. They have to be trained in all the ways in which to deal with and how to deal with. Our dispatchers are also trained the same way. When they take the phone call, how do they dispatch that? We now have the ability through our department to have a person on scene in less than 5 minutes when they get the 911 call. So our goal is to educate the public, let them know that we're there for them, we're their best friends. They can call us and know that our men and women are trained appropriately in a way which they can refer them to Shelly, they can refer them to other areas that we have. We've also been working with some of the hospitals in a small way right now, so that we do not have to Baker Act these people, that we can take them to an area and there's a designated set-aside area where they can just be evaluated instead of being treated like they're criminal, they're being treated like they're out of control. And these people are very kind, they're very sincere, they're very genuine, and it's something that is kind of really important to us in law enforcement. We've never been able to do that before. So
I know that the Silver Alert issue is really a state issue, and I know folks that you go on the highway and go on 595 or I-75 and you see these messages that says Silver Alert, which means that we have a memory disorder or Alzheimer's or confused person driving and they don't know where to go, and we ask the public to please report it. That's basically the elements of Silver Alert. But tell me about Lost on Foot. What's the Lost on Foot program?
Actually, so Lost on Foot is the sequel to Silver Alert.
Right.
And we realize that there are so many people that are wandering and that have gotten lost, and we're not able to track the statistics on it. And I'm just going to read you these numbers. There are 4.3 million residents in Florida over 60 years old. 502,000 have been diagnosed with Alzheimer's. Now, we don't know how many have not been diagnosed, but 502 have been. 60% of these people will wander. And it's not if they're going to wander, it's when they're going to wander. They get confused. So what we did, and actually Rick and I are on the state committee, and Broward, Palm Beach, and Brevard County have received a grant from the state to set up the protocols for Silver Alert, for Lost on Foot. So that's what we've been doing this year. And the way that the program is going to work is that law enforcement will send an email to 211 with the information on that person that's missing. 211 in each county will enter it into a listserv, and the memory disorder centers and aging and disability resource centers will be notified by email that a person has wandered away, just like we do with Silver Alert. We're all notified throughout the whole state anytime there's a Silver Alert activated, wherever it is in the state. So the Memory Disorder Center will be able to respond to that family and provide them with the education and the resources, and maybe get them involved in the bracelet program through the Alzheimer's Association or Safety Net, one of these different organizations. We realize that it's imperative that the person call within 5 minutes of realizing that that person is missing. Many times the caregiver will go next door to their neighbor, they'll call their daughter, their son, they'll walk up and down the street. By that time, it's very dangerous for the person that has wandered away. So law enforcement wants to know within 5 minutes. They want a phone call. And the Memory Disorder Centers, again, will provide the information and resources to prevent this from happening again. And we'll be able to track the statistics so that the state actually knows how many of these people are wandering. The Memory Disorder Centers are educating the daycare centers, assisted living facilities, the nursing homes, and also the family caregivers. And all of the training is on the Department of Elder Affairs website. And they're setting it up so that the people that work at these facilities will actually receive a certificate once they have completed the training that's on the website.
You know, it's an interesting thing. This happened just recently, and I won't mention the venue other than the fact that it was an arena. And I walked into a parking area, and I saw someone wandering. Well, it's not unusual. I've lost my car in these arenas too, but this person was really, they were almost frantic. And I, and they said, well, do you have a key? And he didn't have the key. And I said, well, did you go to the game? Yes, yeah, and he can't find his car. Well, literally, he couldn't find himself.
Right.
I mean, because when finally people were looking for him, I guess it was family members, it was younger people, must have been his sons or grandsons. They found him and they said, Grandpa, we're here, So literally he wandered. I think they told me they went to the restrooms or whatever, and he was just carried away by the crowd, and then he was lost. In other words, he was lost. Now, I know that that's an unusual case, but I don't think it's that unusual.
No,
I know that
no.
I hear from, I've known management at a very large supermarket chain that tell me that there are a number of people that get lost in their, not because they don't know where certain items are, but they wander and they get lost within a store, or they walk outside and they don't remember whether they walked there or got their car there. So that's basically what you're trying to do on Lost on Foot. In other words, answer the issue right away, mitigate the potential harm to the individual, and get a humane response. Is that what it is, Rick?
It is. One of the things we're doing is educating the public, going into the community centers, going into the shopping areas, going into local businesses and senior citizen facilities. Our officers are taking the brochures and the flyers, and we're asking people to register your family member. So all we're asking is to fill out the information. If they have a picture for their family member, give it back to our officers, and we collect them, and then we take it back to the police department, and we put it in our database. So when an individual is out there and we find them, we can always go back to our database. We have a picture of them, we have information on them, we know who their caregiver is, we know where they live, where they walked away from. And that is really helping us. And we're encouraging family members to get bracelets so we can track them. We have all the tracking system that is necessary. It is in our police cars. And we're able to find the individual within a certain area. But as Shelly said, if we can know in 5 minutes or 7 minutes, then we have people going from all over the city of Plantation and all over the county going to that house. So we may find the individual as we're on our way, and that's the chance that's really going to help the family. So the key is to let the public know and the community know there is a way for us to love and care for and help you help your loved one in a time like this. It's a great opportunity. Law enforcement is so on board, and we have found even in our law enforcement community, once this has gotten out, we have several family members in law enforcement in our entire agency that they had relatives and loved ones who had Alzheimer's themselves, but they didn't know what to do. So this is something that's so exciting because we're now able to give our heart, and not just our work, but our heart to people and help those people who have great needs. I mean,
You know,
it's just,
I'm sorry.
no, it's just a great opportunity.
Jurisdictionally, are law enforcement agencies, for example, as the sheriff department, involved with this?
Yes,
now?
sir.
Yeah, because I mean they have so many jurisdictions.
Yes.
It would be very, very helpful. It's almost like a 911 system, you know, because I mean when it happens, and if one agency needs the help of another agency, at least it's there. Shelly, let me ask you this question: with all, and I know that the focus from the research end and from the healthcare end has been dramatic in the cognitive disease issues of dominantly Alzheimer's. That I'm beginning to see the non-functioning of what we would call the respite programs. The respite centers are starting to close up in some of these parts of the state. That must be really difficult because the Alzheimer's patient, the cognitive disease patient, the Alzheimer's patient, is a difficult patient, not because they want to be, it's just difficult. There's a lot of stress on the family members.
Yes.
And the respite centers were, just what I said, they gave respite to the family and the caregivers.
Right.
What is going on?
Well, that's a good question, and I mean, all of the caregiver programs that we offer, I usually go and speak at all of the care assistance programs, and the one thing that I tell the caregivers is that you need to contact your legislators. You need to know that you want to keep your loved one at home, but you can't do it without the assistance, without some funding. And to prematurely place somebody in a nursing home costs the state a lot more than it does for them to support these respite programs. And the caregivers, I mean, if it's a spouse, they're in their 70s and 80s. Although we've been diagnosing people, quite a few, I would say about 10 within the past year, in their late 50s, which is really frightening. So now it's impacting younger people, working people. Some of them have children at home. And unfortunately, with all the research that's been done, and the Memory Center has been there for 30 years, and I was involved in the inception of it. I know I don't look that old, but
No, you don't look old. Rick told me that before we started the broadcast.
right. But we don't.
He said I was old.
We just.
I'm only kidding, Rick.
We just don't have a treatment. We don't have a cure. The medication that's out there may put the person in remission, but until we know what causes Alzheimer's, we're not going to be able to actually treat it.
Well, I think research is going at speed, warp speed now. I mean, the interest of the general public is because we have an aging, surviving public. Mm-hmm. Don't forget, you just read statistics about all of the people that we have in the state of Florida over what you said, age 60. Mm-hmm. Well, I can tell you that Broward County has the highest percentage of people over the age of 80 of any place, almost with the exception of Arizona, right, in the United States.
Yes, sir, and I think that's why it's important that we get the word out. They can contact the Memory Center. There are avenues and resources that we can provide for them. When we go to caregiver meetings, we see a lot of caregivers who are just tired. They love their loved one, they care for them, but they get tired and they have no resource themselves to go out and get some kind of relief. And they don't know that. So I think it's our goal, and obviously I think it's your goal, and the reason why we're here is to let them call their local law enforcement department, get their loved one registered so we can make them a little bit more secure and not for fear and when they're missing. We also educate on how to secure your home because they say, well, no matter where we put the lock on the house, they can get out. So our officers can go in and meet with the family members and say, this is the best way to secure your house so they won't feel like they're in jail. So they'll have some freedom themselves. And so we don't have enough time to talk about all the opportunities that are out there, but they're there, and I thank you for letting us do this. This is amazing that we're able to get this word out to people.
Well, I'm glad because, we have this unusual view of law enforcement, and I understand the social I guess you could say, conditions. But you know, our law enforcement people, our firefighters, our public servants really go so far beyond their required duties.
And I've been doing this for many years. We always see the things that they do. We do have law enforcement officers that make mistakes and for whatever reason. But people lose sight of, and it never gets known, that how many babies are alive today because somebody breathed life into that individual. How many senior citizens have been cared for when they couldn't find a place to go? How many homes have been put back together in the midst of a domestic violence? How many times an officer has worked overtime on their own or seen someone out on the street? So firefighters, paramedics, you know, we're people, you know. This isn't just a job for us, it's a life. It's the way we live our lives in caring for others. So I appreciate you sharing that, because it's like we're here to help people, you know. I think it's exciting, and I've always said this, there's a reason that badge or that star is over your heart, and not on this side. It's because that badge covers a heart that will go out and help anyone, anytime. So it's just great. I was thinking about it just now as you were sitting here, how we had a show where we had a group of paramedics over in here. We were talking about, actually, it was talking about the certified stroke programs, which, by the way, the same hospital,
Right.
one of the first certified stroke programs in the United States.
Right.
Dr. Murray Todd is the greatest single advocate.
And also, I don't mean to interrupt you, but our memory center is the only Joint Commission certified Alzheimer's disease specific center.
Really? Well, again, that's at North Broward Hospital,
Yes.
which is up on Sample Road and I-95. And again, I got to mention Dr. Murray Todd,
Absolutely.
because he's the
He
advocate.
is.
He's
Yes.
the one.
Yes.
I remember very clearly him working not only the members of the Florida legislature, but the Congress people and on the Hill in Washington, trying to set and support standards for certified stroke centers. And it has saved a lot of
Yes.
people's lives. Let me get back to your memory center, because we've sort of got off here. Lost on Foot
Yes.
is, again, it's a derivation of the Silver Alert program.
Yes.
So in other words, you're not in a car, but you're lost walking about.
Correct.
These are not necessarily elopements. People have, you know,
Nope.
they've gotten lost, right?
Right. They wake up in the morning and they get ready to go to work in New York. They're going to catch the train because they're confused. They don't realize where they are. So they get dressed and they just leave the house as if they went to work 10 or 15 years ago.
And your program is open to anybody who calls,
Yes.
right?
Yes.
And you say it's fully funded in essence,
Yes.
to the level in which you can provide services.
Correct.
And you're looking, and I don't want to put words in your mouth, but you're looking for advocacy from our viewers
Yes.
to communicate to the legislative leaders that we need to continue to fund respite programs, and we need to, I guess you could say, elevate the interest in programs like yours for the entire state of Florida, because there are people in rural areas
Yes.
that have the same problems as people right here in Broward County.
Absolutely. Yes. That is absolutely true.
So we're down to the last minute of the show,
Okay.
so I'm going to give you your last opportunity to give a shot.
Okay. I just want everybody to know we're here to help. Our phones are open. We have social workers. We have a nurse. We know that you need the support. We care. Just call us. We're here for you.
Okay. And Rick, my friend?
Yes, sir. We have programs, but I've always said that programs don't reach people. People reach people. And so if they'll reach out to someone and use the sources that are provided, would be great.
Okay. Well, folks, we wanted to bring some interest back to the Memory Disorder Center in North Broward Hospital, but also to the fact that it's your life that's being affected, and we want you to have a pleasant and beautiful life well into the 90s. And one of the ways to do that is to take care of yourselves, as I always say, but also there might be someone in your family or a neighbor that needs a little help. So the Lost on Foot program, which is new, basically, which is an element of the Silver Alert program. You all have seen it up on the roadways. But it all relates to helping people who have cognitive disease, Alzheimer's. There are hopes in the very near future. There's a dramatic research that's going on. But until we can get those breakthroughs, we need you to allow your hearts to help these individuals, as Rick Braswell said earlier on. So we thank you for tuning in one more time to Dateline Health. Remember, this is your show. If you have any issues that you want us to bring up, just let us know. If you have any questions about the show, there's an email address and a telephone number. And as I always say to yourself, take good care of yourself, and in this case, also take good care of your family members and your neighbors. We come to you from Nova Southeastern University. This program is called Dateline Health, and my name is Fred Lippman. Until next time, see you.